Sanibonani Mzansi. I am your host Candice Khumalo and I welcome you to another episode of the Health from Mzansi podcast. Today, we're biting into a topic that's often overlooked: how the food we eat affects our oral health. From sugary snacks to acidic drinks, it turns out what we eat doesn't just impact our waistlines, but it's a big deal for our teeth and gums too. Joining me to explore this further is dentist Dr Boitumelo Fatola, who will explain how exactly do certain foods affect our mouths and what can we do to keep our teeth and gums healthy for years to come.
My name is Boitumelo. I'm a dentist. I've been in practice for now 20 years. I studied at Medunsa, which is now called SAMU, and I did dentistry and I qualified in 2004. And right now I am working in a public hospital in Limpopo, and work-wise, that's what I do. Other than that, I'm a mother of two. I'm a wife. When I'm not doing dentistry, I do pageants, modeling, and all that other cool stuff.
Thank you so much for that lovely introduction, Dr. Boitumelo. Let's go straight into what we'll be discussing today: how diets can affect our oral health. So, Dr. Boitumelo, could you just explain how our diets are connected to oral health? Specifically, how do the foods we eat impact the condition of our teeth and gums?
First thing is that most of the food that we eat is acidic. Bacteria grows and breeds in acidity. And more than anything, also, the acid eats up the protective layer of the tooth, which is called the enamel. And that's how it affects our teeth and our oral cavity. And for the teeth, it's mainly the bacteria and the acidity in the mouth. And then with regards to the gums, it's mostly the technique in which we brush our teeth and also not visiting your dentist regularly.
Dr. Boitumelo, I'd like to believe that most people are aware that sugary snacks are bad for our teeth, but there's possibly everyday foods and drinks that might be more harmful than we think. So could you just highlight some lesser known culprits that can damage our oral health?
Like you said, most people think that tooth decay is caused by sweets. Yes, that is true, but also it's the food that we eat that sticks on our teeth. Like your snacks, your chips, when you eat them, they get stuck on the teeth. Your biscuits, those are the culprits that we are not normally aware of, but those are the culprits that always sticks on the teeth and causes the decay. So you have your sweet corn, you will eat your sweet corn, and then those debris of the sweet corn, they will be in between the teeth and stuck on the tooth. So those are good food, but then the only thing is that they will stick on the tooth. They will stay longer on the tooth. Same with the drinks. Milk stays longer around the mouth, around the tooth, because it's acidic. Cold drink as well. It's acidic. We know about that. But milk is one thing that people don't realize, that it's also a culprit in causing the tooth decay because it stays longer.
So, Dr. Boitumelo, is there possibly a recommended frequency for consuming those types of food you just mentioned to minimize the impact on dental health?
Not really. You can eat all of these food. The healthy food is highly, highly recommended. Your fruits, your vegetables are highly recommended. Slow down on your sugary stuff, your chocolates, your sticky sweets, your sticky chocolates. Even nuts, those are the things that I forgot. Nuts are healthy, but then they stay longer on the tooth. The frequency is not so much of a problem, but then the best thing that you can do for yourself is that every time you finish eating, rinse your mouth. And every morning when you wake up, brush your mouth. Every evening, let it be the last thing that you do. You brush your teeth and then you rinse your mouth. You do that because you want to take out all the food debris, everything that you have been eating throughout the day that has been stuck in your mouth. So basically, what is important is that whatever you eat, you must make sure that it doesn't stay long in the mouth. First, by drinking water or rinsing your mouth. Secondly is the brushing at night. That is the most important one of all. And then you can also use the sugar-free gums. Those are also high for people who eat gums. I'm not big on gums, but it will help to take off the food from your mouth, and it will balance your pH as well. Because what we want is to keep your mouth at alkaline or a more balanced pH.
So are there any surprising foods that can actually benefit oral health?
Surprise, surprise. Apparently, dark chocolate is good for your oral health.
Oh, wow.
It was a surprise as well for me. Well, as a lover of chocolate, it was heartwarming to know that at least I can still get that sugar craving down with something healthier. So apparently, yes, dark chocolate is a healthier option. It's got this mineral called the tannins that is healthy for your teeth, that balances your pH in the mouth. So let's go wild with our dark chocolate.
Thank you so much for mentioning that, Dr. Boitumelo. So just in closing, what changes would you advise people to make to reduce the risk of tooth decay and gum disease, and just to improve their overall oral health?
So we are a generation that works really hard and that always needs supplements, mostly use supplements, whether it be the energy drink, the coffee. We are the generation that tries to be healthy as well, and mostly we will be using lemon water, and those are the biggest problems to our teeth. But then there's always a solution, and the solution is that when you drink all of those drinks that I've mentioned, just wait at least 30 minutes before you brush your teeth. Just wait at least 30 minutes. And then also drink water after 30 minutes after drinking all those beverages. And the main thing is that visit your dentist twice a year. So every 6 months, visit your dentist. Why? Because we want to see problems right at the beginning, and we correct those problems. And if there's any other thing that needs attention, we get to see it well on time. So the main thing is that hydrate. Water. I can't emphasize that enough. Drink a lot of water during the day. It helps to flush out anything that is in the mouth that can build up bacteria in the mouth that will eventually cause tooth decay and gum disease. Gum disease is the most dangerous one because eventually, when it complicates, it causes bacteria in the blood that also will affect your heart and cause heart attacks. So we don't want a build-up to all of those complications, because now it then becomes a general health problem. So it starts in the mouth. So hydration, brushing regularly twice a day, flossing is the main thing. You floss once a day and you just hydrate and see your dentist. Those are the 5 pillars of keeping your oral health healthy.
Thank you for joining this week's episode of the Health from Mzansi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Mzansi podcast, and your ears are always invited. And that's all for today's episode on the powerful connection between diet and oral health. We hope you now have a better understanding of how the food you eat can impact your teeth, gums, and overall well-being. Remember, a healthy smile is just a bite away. Making informed food choices can lead to a healthier and happier smile. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.